Imagine this. She's on a date, things are going smoothly, maybe even sparks are flying, and then, ouch. Not metaphorical sparks, literal stabbing pain downstairs. Or maybe it's just a casual day she's sitting at her desk and every chair feels like a medieval torture device. Yeah, that happened. This, my friends, is the world of vulvodynia. Chronic, mysterious, and painfully real vulvar pain that shows up uninvited and refuses to leave. No visible cause, no one to blame, and a whole lot of confusion for her body and mind. It's like her nerves decided to stage a hostile takeover, estrogen hit snooze, and her confidence just packed a bag and left. In today's video, we're diving headfirst into vulvodynia, why it happens, what triggers it, and most importantly, how women can start reclaiming their comfort, pleasure, and sanity. We'll cover the science, the psychology, and some real-life remedies that actually work. So if you've ever wondered why your body seems to have a personal vendetta against you, stick around because this one's for you. Vulvodynia is the kind of condition that makes women feel like their own bodies are playing practical jokes on them, except the joke is painfully persistent and nobody's laughing. At its simplest, vulvodynia is chronic vulvar pain, lasting at least 3 months without an obvious cause. That means no infections, no rashes, no obvious irritation, just relentless discomfort that can show up during sex, sitting, exercising, or even when she's just trying to wear her favorite jeans. Not ideal. Here's the kicker. Millions of women experience this, but very few talk about it. The shame, confusion, and embarrassment mean many suffer in silence, and that's partly why the condition remains misunderstood, both by the general public and sometimes even by healthcare providers. On the physiological side, vulvodynia often starts with nerve hypersensitivity. Imagine her vulvar nerves suddenly deciding they're on high alert, firing pain signals at the slightest touch. Her brain receives these signals, and boom, the area interprets everyday contact as pain. Peripheral nerves in the vulva can be triggered by inflammation, subtle injuries, or even changes in the vaginal microbiome. In some cases, the tiny muscles in the pelvic floor become chronically tense. Think of her pelvic floor as a car engine, revving constantly in neutral, making even simple movements uncomfortable. Hormones also play a starring role. Estrogen isn't always consistent. When levels dip, vulvar tissues can become thinner, drier, and more sensitive. Progesterone fluctuations can affect nerve signaling, and testosterone, or lack thereof, might influence tissue resilience and nerve function. So yes, her body is basically juggling a hormonal circus, while her nerves are screaming at the back of the crowd. But it's not just a physical puzzle. Psychological factors are heavily intertwined. Chronic pain often comes with a side of anxiety. A woman experiencing repeated discomfort may start hyper-focusing on sensations, anticipating pain even in neutral situations. Her brain starts rerouting normal touch into a pain alert system. Past trauma or negative sexual experiences can prime this hypersensitivity, making her nervous system respond as though every touch is a potential threat. Her confidence? Yeah, bad day to be her confidence. And then there's the daily life pain. Something as simple as sitting on a hard chair, wearing tight pants, or even biking can become a source of dread. Over time, her body starts associating routine activities with discomfort. Even when she tries to relax, her brain keeps a silent checklist. Do not sit too long. Do not cross legs. Do not breathe too hard. It's exhausting. Yet, despite all this, vulvodynia is treatable. It's not a punishment, it's not imaginary, and it's certainly not a reflection of her worth or sexuality. The key is understanding the interplay between her nerves, hormones, and brain, and then finding targeted solutions, both medical and behavioral, that help her reclaim her body. Once she knows what's happening under the hood, the mystery becomes manageable, and relief becomes a realistic goal, rather than a fleeting dream. If vulvodynia were a TV show, hormones and nerves would be the chaotic duo constantly plotting against her comfort. Estrogen, progesterone, testosterone, they all take turns deciding whether her vulva is soft, supple, and pain-free, or hypersensitive and ready to throw a tantrum at the slightest provocation. Low estrogen, for instance, can thin vulvar tissue, reduce lubrication, and make previously harmless friction feel like sandpaper. Progesterone fluctuations? They can subtly tweak nerve sensitivity, leaving her vulva on edge for days. And testosterone, well, let's just say, when it's out of balance, her tissue resilience and nerve threshold take a hit, making any minor stimulus feel amplified. Then there's the neurological side, which is a whole other layer of drama. Chronic pain often involves something called central sensitization. Her nervous system basically decides to be hypervigilant, turning minor touch into excruciating pain. Peripheral nerves in the vulvar area can fire excessively, and her spinal cord amplifies the signals before they even reach her brain. Every step, every brush of clothing, every subtle touch, her nerves register as a full-blown alarm. It's like her body installed a smoke detector that goes off when someone lights a match 3 rooms away. Stress and anxiety also hijack the nervous system. Chronic stress puts her sympathetic nervous system, the fight-or-flight switch, on overdrive. That means her pelvic floor muscles are constantly tense, blood flow is reduced, and nerve signals are amplified. So when she sits down or attempts intimacy, the pain is worse because her body is already in red alert mode. Her nerves aren't just firing, they're firing with flare guns. Scientific studies back this up. Research shows that women with vulvodynia often have increased nerve fiber density in the vulvar vestibule, meaning her body literally has more pain-sensing wires in the area than average. Functional MRI scans reveal heightened brain activity in regions associated with pain perception, even when the stimulus is gentle. Essentially, her body and brain are teaming up to misinterpret harmless sensations as threats. And this isn't just about sexual activity. Everyday triggers, tight clothing, prolonged sitting, even minor friction from walking, can flare the nerves. Some women notice cyclical patterns where pain spikes during low estrogen phases of the menstrual cycle, highlighting how deeply hormones are intertwined with nerve function. Her body is basically running a full-on synchronized chaos show, and she didn't even buy a ticket. Understanding this interplay is crucial because it explains why vulvodynia can persist even when there's no infection or injury. It's not imaginary, it's a real physiological and neurological reaction. The combination of hormone fluctuations, nerve hypersensitivity, and stress-driven nervous system overactivity creates a perfect storm. And while her body may feel like it's plotting against her, this knowledge is empowering. Once she knows what's driving the pain, she can begin interventions that target both the hormones and the nerves, rather than blindly hoping it will magically disappear. Vulvodynia doesn't just live in her body. It moves into her mind, rearranges the furniture, and makes herself feel like a stranger in her own life. Chronic pain and the brain are inseparable roommates, and when one overreacts, the other usually follows suit. Anxiety, overthinking, and catastrophizing become part of the daily routine. She starts anticipating pain before it even happens, and her nervous system, ever eager to cooperate, jumps right on board. It's like her anxiety grabbed the steering wheel and is driving the pain narrative straight into chaos. Sexual trauma or negative past experiences can also be invisible accelerants. Even if the pain isn't directly related to prior events, her nervous system remembers what hurt feels like. So when intimacy comes around, her body may default to defense mode. Tight muscles, heightened sensitivity, and preemptive pain perception. Her pelvic floor muscles refuse to relax like bodyguards suspicious of every touch, and her confidence quietly exits the room. Lifestyle factors, though subtle, have a surprising impact. Tight jeans, certain fabrics, or synthetic underwear can physically irritate vulvar tissue. Hygiene products like scented soaps or wipes sometimes exacerbate inflammation. Sitting posture, long bike rides, or even repetitive friction during exercise can subtly worsen sensitivity over time. Imagine her daily life as a minefield. Every innocuous action has the potential to set off an alarm. And she isn't doing anything wrong. Her body's just on hyper alert. Diet can also play a role, though science is still untangling the exact links. Some women notice symptom flares with certain foods that influence inflammation or the microbiome. Excess sugar, highly processed foods, or irritants like caffeine can subtly tip the balance toward discomfort. Again, her nervous system is primed to notice every small disruption, so even minor triggers feel magnified. It's important to stress, vulvodynia isn't all in her head, but her mind-body connection is very real, and psychological patterns can amplify the intensity and frequency of pain. Women often feel guilt, shame, or embarrassment, which feeds anxiety, which in turn feeds the pain loop. Her confidence takes a hit every time she anticipates discomfort, creating a self-reinforcing cycle. Fear leads to tension, tension leads to more pain, and pain reinforces fear. Practical shifts can make a noticeable difference. Simple changes like switching to breathable cotton underwear, avoiding irritants, and modifying sitting posture can feel like small victories. Mindfulness practices, relaxation exercises, and cognitive strategies to reframe pain perception can also reduce the brain's overreaction to nerve signals. Picture her slowly reclaiming control, her nervous system still a little dramatic, but her confidence sneaking back in one step at a time. By acknowledging the psychological and lifestyle contributors, she can start untangling the web of vulvodynia. She's not broken, her body isn't against her, and every small adjustment is a move toward relief. It's about empowering her to work with her body, not against it, and setting the stage for both medical and self-care strategies to truly take hold. So she's figured out that her body, her nerves, and even her mind have been conspiring against her comfort. Great. But what now? The good news is that vulvodynia isn't untreatable. It just requires a multi-pronged approach that targets the nerves, the muscles, the hormones, and sometimes her mindset. Medical treatments often start with the basics. Topical anesthetics, like lidocaine creams, can calm those overactive nerves for short-term relief. Hormonal therapy may help if fluctuations are contributing. Think low-dose estrogen creams to restore tissue health, or, in select cases, systemic hormone adjustments. For women whose pelvic floor muscles have decided to go rogue, pelvic floor physical therapy can be a game changer. Skilled therapists teach relaxation, targeted strengthening, and techniques to release chronic tension, basically helping her muscles stop acting like they're auditioning for a horror movie. Then there are nerve-focused interventions. Some doctors use nerve blocks or neuromodulators to reset hyperactive nerve pathways, while others explore laser therapy or other minimally invasive techniques to reduce hypersensitivity. These options aren't one-size-fits-all, but they can be transformative for the right patient. Her nerves might still grumble, but at least they stop holding open a constant complaint session. Complementary approaches can be just as critical. Mindfulness, biofeedback, and cognitive behavioral therapy address the psychological overlay, teaching her nervous system that not every sensation is a signal of danger. Lifestyle tweaks, like switching to non-irritating underwear, avoiding certain soaps, or sitting on softer surfaces, act as tiny but cumulative relief points. Dietary adjustments may also help, particularly when inflammation is a factor. It's a holistic game. Treat the tissue, calm the nerves, and coach the brain. Practical day-to-day strategies matter too. Warm sitz baths, gentle stretches, and over-the-counter lubricants can reduce immediate discomfort. Lubrication and vaginal moisturizers before intimacy prevent friction-induced flares, while communication with a partner ensures sexual activity doesn't become a minefield. Some women even find that simple pacing of activities, like taking breaks during exercise or alternating seating positions, dramatically reduces flare-ups. Small steps, but they add up. What's key is a team-based approach. Gynecologists, pelvic floor therapists, pain specialists, and psychologists each bring a tool to the table. When they work in concert, women often experience not just relief, but empowerment, finally feeling like they're in the driver's seat, instead of their body being the hostile territory. And while there's no instant cure for everyone, combining medical treatment with lifestyle and psychological support significantly improves quality of life. She can reclaim comfort, intimacy, and confidence, but it requires persistence, patience, and a willingness to experiment under guidance. Her body isn't broken, it's just been misfiring. With the right interventions, her nervous system can calm down, her hormones can cooperate, and her confidence can finally get an uninterrupted nap. Relief is possible, and taking action is the first step. Living with vulvodynia isn't just about managing pain. It's about navigating the emotional minefield that comes with it. Chronic vulvar discomfort seeps into everyday life, making intimacy stressful, social situations awkward, and even self-perception shaky. Women often feel isolated, embarrassed, or ashamed, like there's something wrong with them. But here's the reality. She's not broken, and her body isn't betraying her on purpose. Vulvodynia is complex, but it is manageable with knowledge, support, and strategy. Emotional coping strategies are essential. Open communication with partners can dramatically improve experiences. Explaining pain triggers, pacing intimacy, and finding alternative ways to connect sexually and emotionally reduces anxiety and fosters understanding. Support groups, online or in person, provide a safe space to share experiences without judgment. Just knowing other women are going through the same thing can normalize her feelings and provide practical tips. Sometimes the best medicine is hearing, "Yeah, that happened to me too." She can also reclaim control through self-care routines. Gentle pelvic floor exercises, mindfulness, and relaxation techniques help retrain the nervous system to interpret touch as safe, not threatening. Small daily victories, switching to soft underwear, experimenting with lubricants, or adjusting seating posture, build confidence over time. Each successful adjustment reminds her that she does have agency over her body, even if it feels unpredictable. Professional support continues to be critical. Multidisciplinary care, gynecologists, pain specialists, pelvic floor therapists, and psychologists offers both validation and targeted strategies. Treatment plans tailored to her specific triggers, lifestyle, and emotional responses create a roadmap to relief. Relief may be gradual, but progress, even incremental, strengthens self-trust and reduces fear-driven tension. The psychological payoff is profound. As she learns her body's cues, understands triggers, and incorporates coping techniques, she begins to feel empowered rather than victimized. Her confidence slowly returns, intimacy becomes less intimidating, and pain, while still present for some, loses its dominance over daily life. Vulvodynia may be chronic, but it doesn't have to define her life, relationships, or sense of self. At the end of the day, living with vulvodynia is about reclaiming the body that feels unpredictable and frustrating. Through education, lifestyle adjustments, emotional support, and professional guidance, women can regain comfort, intimacy, and confidence. The key takeaway? She is not alone, there are solutions, and each small step is a victory. Vulvodynia is complicated, persistent, and frustrating, but understanding it changes everything. We've covered the causes, from nerve hypersensitivity and hormonal fluctuations to psychological triggers and lifestyle factors. We've explored remedies, from medical treatments like topical anesthetics and pelvic floor therapy to mindfulness, lifestyle tweaks, and emotional coping strategies. Most importantly, we've seen that women are not broken, their pain is real, and there are actionable ways to reclaim comfort, confidence, and intimacy. If you're dealing with vulvodynia, remember, small changes, professional support, and self-awareness add up to real progress. Your experience matters. Share it in the comments, and I'll reach out to connect directly. Don't forget to like, share, and most importantly, subscribe to the channel. We're building a community where women understand their bodies, empower their minds, and take back control of their lives together.